at a time when some of their underlying biology has changed in such a way that that is more difficult for them than other students. And really thinking about reinforcing some of the personal and educational support systems that these children may need to succeed. What about select interventions? Well, these I really think of in terms of treatments. They're interventions for kids who have gone on to develop depression, who develop PTSD, to develop substance use disorders. And I think the goals here are really one, as you think about the multiple systems that Sue was referring to, really making sure that they're working together so that the students, wherever, I don't care what door they've walked through. I don't care if they've walked through the child welfare door, I don't care if they've walked through the juvenile justice door, I don't care if they've walked through the school door. How can we work together to ensure those students get appropriate and effective treatment? And that everyone is on board with that. How can we address those disorders that we know impair learning? And how can we remediate those adverse effects and help them be resilient in the face of future trauma? I would love it if all of the kids I worked with had only experienced one trauma and that was going to be the end of it. For the vast majority of our children, that is not the reality. That is not the reality. So we need to think about this, not just in terms of helping them in the past, but helping them in terms of being more resilient going forward. Okay. So now let me kind of dive into the details, and I realize these slides get kind of busy, and for that, let me apologize in advance. So Tier 1, all students. I think it's important, and these are things that teachers can be taught and do very quickly. Realize that there are triggers that are likely to trigger students who have been exposed to traumatic events, and I'm going to generalize here, but we certainly know that loud, chaotic environments for children who've been traumatized can be problematic. We know that situations that generate feelings of helplessness, of vulnerability, can be triggering for those students who've been exposed to trauma. We can help teachers think through other strategies to minimize. We're never going to make a middle school lunchroom a non-chaotic environment, at least not in any school that I'm aware of. But there are things we can do to help these students to mitigate that. We can talk to teachers about, particularly for these students, the importance of clear, predictable routines and expectations. Yes, we know that helps all kids. For these kids, it's particularly important. We can provide opportunities for choice and sense of control and spaces for calming down. These are things that can be very easily integrated if we can only get this information out to teachers. We can also provide specific skills to really help teachers kind of more broadly in services and trainings and how to interact with students after they've been exposed to traumatic events. Some of you may be familiar with psychological first aid, which really helps teachers develop sort of a skill set and way of thinking about working with students when there's sort of been a community-wide disaster. So you'll oftentimes see this brought up after the recent hurricanes, after school shootings. You'll hear about psychological first aid. Also, there are a variety of sort of culture and climate changing interventions, things like positive behavioral intervention support, PBIS, and school-wide PBIS, and a variety of other sort of environmental changes that really sort of helps to provide the universal context on which schools can build some of those other things. What about Tier 2? Okay, so now we're talking about at-risk kids. What about particular strategies? Well, sometimes these kids will become overwhelmed. You can work with those kids in advance to think about permission to leave class and strategies for safe places to go if they're feeling that way. For kids who are having trouble concentrating, who may be walking home and living in an ongoing environment with ongoing traumatic exposure or living in that community. There are ways to provide additional supports, check-ins, and other things to really help those students be able to succeed. Certainly many of these, not all of these students, we need to think about how we sort of incorporate these types of strategies and accommodations within 504 plans, within IEP plans. There are structures in schools that can be we can get going to be able to provide these supports. We need to provide safe places to talk about these programs. And then there are a variety of programs. SET, which is designed to be delivered by teachers. CBITS, which is designed to be delivered by clinicians working in schools, probably from upper elementary up. That, yes, it's a challenge, but we've now been able to support the implementation of CBITS in every state of the union, and I think over 10 international countries. We estimate that since the paper was published showing it's effective in 2003, that probably over 20 to 30,000 kids in the United States have received this program. So there are ways to get these programs out there, and these are programs that work. Bounce Back is a newly developed program that's being used to help children in early elementary and younger, help them with traumatic event exposure. It was used up in Newtown after the shooting up there. So again, there are programs, in addition to sort of those strategies, there's specific programs that are out there that can be useful. Okay, thank you. Finally, let's talk about sort of the clinically focused program, the Tier 1. So here, in terms of strategies, these are kids who probably need clinical services. In some cases, they may be available in schools through co-located models or clinicians. In other cases, there may not be. So we need to figure out ways to get these kids referred for appropriate evaluation and appropriate treatment. I'm a fan of delivering these services in schools, but that's not going to happen anywhere. So different communities have to come up with different solutions, but there are ways. These could be school-based services, these can be community-based services. Some communities have found ways to blend these services. These students often need individuals to advocate them more. In the best case scenario, this is their parent. But in other cases, this may need to be someone out of the educational system. These children need that advocate for them. Again, here you're talking about appropriate accommodations on an IEP or on a 504, and these may go well beyond some of those that I alluded to previously. We've talked about collaboration. For this to work, you need to have good communication between school personnel and the clinical personnel. And we've done studies of this. And oftentimes we'll hear, well, what about FERPA? Or what about HIPAA, right? If you actually look at the law, and there's some materials out there, the limitations based on those and actually being able to communicate between educators and clinicians is not that great. It's far more used in an excuse for we don't want to talk than we can't talk. And I can direct you to resources that you can take to your districts and you can take to your clinical systems to make that clear to them. Okay, those are excuses. And again, here we have programs. We have TFCBT. CBITS and Bounce Back are programs that actually bridge between Tier 2 and Tier 3. They can be used both as secondary prevention, but they can be used as clinical treatments, and you can bill Medicaid for them. You can bill insurance for them. So there are a variety of programs. So again, I want to sort of paint this framework, but point out to you that yes, at each of these, there are specific things that we can do, that places around the country are doing to help to sort of put the pieces on this global vision of a trauma-informed school. Now, one question I hear, and we all know, or at least I am not aware of any district that lots of people are dumping bucket loads of money on top of and saying, oh, that's great. Here goes more money, and you can sort of use the resources for everything you want. So we know that resources are an issue. But again, I would suggest to you that increasingly there's attention to these issues. A lot of health systems are now reaching into schools. If there have been secular changes under the Affordable Care Act that actually incentivize health systems to reach back into schools to be able to provide service. And there's a variety of federal funding initiatives that are out there that can be used to support these types of programs. And so behind me, you'll see just a handful. The Now is the Time initiative, which was launched after Newtown, specifically the Project Aware piece of it, out of Department of Ed, can be used to support Tier 1, as well as the Comprehensive School Safety Initiative, which is coming out of NIJ, where I now think they've developed and are trying to implement programs in sort of 20 different regions across the country, by my last count, that are really trying to do these things. Now, if you're not one of those districts, you may not be able to be part of the study, but these people have developed resources. There are resources out there, there's expertise out there in every region of the country. And I know lots of these people. If you come to them and say, listen, we're not part of the study, but God, our school could really use your help in some of the information, these people share, okay? Department of Health and Human Services, again, Department of Education. There are a variety of funding mechanisms as you look at Tier 1, Tier 2, and Tier 3, all of which can support schools in doing this work. At Tier 3, a particularly important one is the federal government last year revised the free care rule, which historically has prevented many schools from pursuing programs that might serve Medicaid students and not Medicaid students. The federal government has revised the rule to relieve limitations on it to make schools far more able to bill Medicaid for these types of services. There are a variety of efforts right now to provide those types of talking points and other things that you need to do to allow districts and states to apply for these funds to get it. That's in the work. Those materials are available through the Center of School Mental Health at the University of Maryland. So I'm not going to say this is sufficient. Yes, I think we need more resources. But let's not kid ourselves that there's nothing out there. There are ways that schools have been able to find to begin to implement some of these things. And again, let me get back to that point. I'm talking about these as sort of arbitrary tiers. They're not, right? A kid at Tier 3 is going to benefit from what the school has in place at Tier 1 and Tier 2. Kids are going to move up and down, and it's incumbent upon the school to be able to sort of monitor and make sure that the school is be able to provide the resources to the student they need by monitoring them and not expend more resources there. You shouldn't be delivering a Tier 3 intervention to someone who's at Tier 2. There are less expensive and more efficient interventions and programs to be able to help them. Finally, and before I stop, I think there are a couple other important considerations that I do want to touch on. And again, I'm going to go back from kind of programs here and talk about other things as we talk about this that I don't think are talked about enough. I've talked about this model, and we're talking about different programs. But let's be quite honest, there are very few schools in our country that can do everything at once, right? And what I'm talking about here is not a matter of coming in and doing training. This is training, this is implementation support, this is type of ongoing to allow school to vary this expertise. So our expectation should not be that schools do it all. Instead, I think schools, with that transparency and decision-making with the other stakeholders in their community, they need to be launched. Schools need to decide what is best for them and to take into account what is going on within their community and a whole variety of factors. And just because a school starts one place doesn't mean that they can't add these others on. But let's not use the excuse that we can't do everything as an excuse not to do anything. Okay? And finally, the focus here is on kids. But the people we're asking to do this are our educators and our clinicians, okay? And we know that any adult who works with children who has experienced trauma is at risk for compassion fatigue. They're at risk for secondary traumatic stress, okay? And particularly those individuals who are empathetic, who may have experienced trauma in their own lives, and who may, through dint of their personality, focus on helping others and neglect or be unaware of their own feelings and needs. The majority of you are in a helping profession. I'm fairly confident that if you don't recognize yourself in this, you recognize more than one or two colleagues. Okay? If these issues are unrecognized and unaddressed, and we do not provide the type of support that these individuals need, we know what's going to happen. It doesn't matter which program you choose. They're not going to be able to effectively implement it. They're going to burn out. There's going to be staff turnover. And any of you who work in frontline mental health agencies or educational system, you see this every day. You don't need me to tell you about this. This is your daily lived experience as the new academic year starts, right? We all know it. And so at the end, I just want to leave you with one final thought, that I think all of us have an obligation to our peers, to our students, to our colleagues, and to ourselves and our loved ones to focus on self-care and make sure that while we are trying to do the best we can for our students, that we are not damaged by the work we do. Thank you very much.
We can take a couple questions at the microphone for Dr. Stein. If there are any, and then we'll move on to some of our Slido questions. Okay. Well, let's start with one of the questions that came in from Slido, which was, what sort of curriculum do our panelists believe is needed for educators to increase empathy to give teachers the tools that they need to deal with challenging students?
So, and I'll turn to others. I certainly know that Department of Education, particularly in sort of trying to help teachers, there are a number of programs out there that really, and again, I'm going to focus, I think it's challenging to teach empathy. I think it's much easier to teach skills, right? And I think there are programs out there that really sort of help to teach teachers and other educators the type of skills to interact with students in a way that is more helpful and more therapeutic. The one I would point you to at this point is Psychological First Aid, Listen, Protect, Connect, okay? And you can find this out of Department of Ed. Department of Ed recommends it. There are others that are sort of in development. But PFA, so there's another psychological first aid for schools that my experience is most schools find it really long and unwieldy because it's sort of written by clinicians. The psychological first aid, Listen, Protect, Connect, is much more accessible. It's written by teachers, and although it's designed to help teachers really be able to support students after sort of a community-wide disaster and event, the skills you're learning generalize. So that's the one that sort of immediately comes to mind. Now, one of the things I've put up behind me here, and all these slides I think will be posted so you can get them. Again, you see our center up here, but we've developed a variety of websites. Trauma-aware schools will sort of have global information, and some of these other programs I talked about have basically specific information that you can go, and if you're a clinician, you can go and get continuing ed credits. If you're an educator, you can go, take an online training, and again get continuing ed credits. So the SET program here, while for teachers is designed to help teachers sort of run groups and as a lesson plan, that also will have specific information to really help teachers better understand what some of the issues are and ways to sort of support students. And so in addition to the training and the intervention itself, there's a variety of implementation support materials, educational materials. So to help sort of everyone learn skills, I'm not sure I'd go through SET if you're a teacher. That's really if you want to be able to run an effective group to help students. But more broadly, there are a variety of things on that website that I think may be helpful.
Brian, I'm wondering if you want to comment on that. I know we talked a little bit last night about a board that you're on and maybe thinking about curriculum for new teachers and those that are learning how to be educators, if there are key things that you think could be incorporated into some of that base training. And you're welcome.
In terms of empathy?
Or skills to deal with.
I don't know if that can be taught. I'm just speaking from anecdotal experience. I've seen some teachers have their own children and become more empathetic than when they did not, or more caring or such, but I see so many candidates, maybe they present a non-authentic version of themselves. We use the Gallup teacher perceiver interview, which is really interesting because it asks questions targeted toward empathy and rapport. And one of the questions that we ask is, it's a little scenario. It says, after school you come across a student whom you know and you see that he's crying. You ask him, what's the matter? And he says he was caught cheating. And what would you do? So many teacher candidates sit down, ask the child why he cheated, and then proceed to lecture him on cheating. Where the teacher worth his or her weight in gold says, well, he's already crying, so he's upset, so I would sit down and listen. So perhaps there are some things that teachers can do to take a step back and realize that there is an empathetic response. Maybe there's some training and some scenarios that would cause them to think about that. But I think that's difficult. I kind of sound very simplistic in what I'm looking for in teachers, but a personality type, a caring a caring type, and I have seen some teachers maybe develop it through life experiences, but I've seen some others that just do not have it. So maybe if they take a step back and start to think through. Sometimes teacher candidates think we want them to sound tough, or that they're not going to be pushed around, and maybe they're not authentic when they answer, but maybe drawing their attention to those kind of things.
Although my one sort of response to that is I'm inclined to agree, as you heard. I'm not sure that we can teach empathy. But one of the things, and this is sort of sad to admit, but in medical school, about a decade ago, they realized that they were recruiting medical students who sort of lacked in empathy, which is a real problem if you're a doctor, right? And so what a lot of the medical schools have started to do is, in some of their early programs, teach medical students to interact with their patients in a way that is empathic. Do we know if that actually changes at the fundamental level who they are? No, but we do know it changes the patient experience. And so I think there are some things that we can teach teachers. Psychological first aid comes to mind. There are, again, some others I know that are currently being developed that really help teachers know that if you see a student crying, this is probably a better response. And is it solving the problem? No. But we may not all districts may be able to find the wonderful teachers it sounds like you're finding. And so what can we do to sort of help our educators more broadly?
I wanted to, sorry, just to add a little bit. This mic doesn't like me. The question about what curriculum is out there to help teach either empathy or empathy-related skills, I think what we've talked about so far have been more of a cognitive exercise, and I'm wondering if it's back to this, transfer from knowledge to skill to behavior, right? And so I'm wondering if a challenge for everyone is not necessarily looking for a particular curriculum, but finding ways to have these skills modeled. So if we already have, for example, teachers who display more empathy with students, or know how, for example, as Brad mentioned, you can teach empathic communication styles. Is there a way that we can have more experienced teachers model this to some of the newer teachers, or in some way maybe develop a video rather than some of those vignettes, which don't get at the emotionality or the experiential components that might be important for the teachers to recognize. It's easy to see this from a cognitive perspective, that okay, if a student's crying, if then becomes very much a logical understanding, but it doesn't get at the core, right? So if there's a way to sort of have them experience what that's like, either seeing it in video form or watching it modeled, then that might be a better transfer from knowledge to then the subsequent skills necessary. I'm not moving this mic.
Okay. Another question is, when there are so many different types and layers of trauma, how do we define trauma in a way that is useful to teachers and schools?
That is actually an excellent question. As I mentioned in my portion of the presentation, when we ask teachers and administrators about their understanding and conceptualization of trauma, it's a sort of very ambiguous term. And I think if we, Brad presented a framework for understanding trauma, I presented a framework for understanding trauma, Brenda yesterday presented a framework for understanding trauma, and I think really selecting a framework that makes it easily accessible and understandable for teachers to be able to say, okay, give, for example, the NTCSN's framework, which is we have to define acute versus chronic. I wonder if that might be a good framework to sort of present this with. In the media, we always hear about school shootings, and it's helpful for everyone to understand that incidents like that could be considered acute if it happens time and time again. These acute incidents then may merge or morph into more of a chronic problem that occurs in schools, which in some school districts, especially in neighborhoods where this is something that occurs every day, becomes part of the reality of the students. And so really understanding that there are these chronic traumatic events, and if you visit the NTCSN website, they have these broad sort of umbrella terms for trauma, but they also give examples of